Gunti, meaning Skinny Fish Lake, is a massive retrofit of the former Territorial Hospital in Yellowknife, and it's gearing up to open this month. It will have extended housing and long-term care for residents, as well as primary care and outpatient rehabilitation services. Here's an individual room, where residents can choose to bring items for their memory box. Director of Continuing Care of the Northwest Territories Health and Social Services Authority, Lisa Raynar, says residents can bring their own furniture or use the basic furniture provided, and they are equipped with medical gases like oxygen. In total, there's 90 beds, 16 for extended care, increasing the capacity by 6 beds compared to the current unit at Stanton Territorial Hospital. The increase in beds should completely clear the wait list for extended care. A new feature, the 4 family rooms for residents from out of town who need a place to stay when visiting, and or to be used when a loved one is dying and families will cycle through.
It's things that we've heard in the past about if people try to come to visit, they only do it when they come for medical travel, because then their accommodations and their travels kind of covered. So if we can also have some people be able to afford to come and visit family members and try and facilitate visitation as much as possible.
Gunti is complete with living and dining room areas where residents can choose what they want to eat. A spa room complete with a lift into tub and sink for washing and cutting hair. And common rooms like a spiritual room and an activity room and outdoor patio space.
As I said, extended care residents currently don't have access to outdoors, and because we're up on a 2nd and 3rd floor, it's not easy access, so having the patios is a huge feature. We know how important the land is, being outdoors is to our Indigenous residents, and so this was in the way that we can.
Raynar says they are implementing input from surveys across the north about the need for more country food.
If they wanted to, or if we get enough of a donation that our food service people can also prepare large quantities. It gives us something as well for the Indigenous Wellness Program that we know has worked really well at Stanton Hospital, that I know sometimes they do caribou stew and bannock on like a Friday, and so it gives them a space that they could use that's like a commercial grade kitchen.
Lastly, the 1st floor is for public health needs, complete with a reception area, primary care units, and 36 exam rooms. Each room has a printer, scale, and height measurement tool, so staff will not have to leave the room for those tasks. It's also the first time rehabilitation services will fall under the same roof, including a physiotherapy gym, private treatment rooms, and sound booths, occupational therapy, physiotherapy, speech-language pathology, child development, and audiology. 1st floor services will move in this month. Early July, staff and patients from extended care will transfer over, and finally, long-term care once the wait list is processed. Charlotte Mort-Jacobs, APTN National News, Yellowknife.